And so we've gone from 87 cases a day back on the 23rd of March now to 722 cases a day in the latest data, reflecting the most recent 7-day reporting period. So it is certainly a reason to take note, be cautious, be careful, protect yourself, your loved ones. These things are tremendously effective, as are the vaccines. All right, you might have heard that. It looks like everyone has permission to record. I believe most of you have my cell number, and so I encourage you, if something comes up or you have a microphone problem, I'd be happy to relay questions. You can text me or you can put messages in the chat, and we'll try to make sure we ask your questions. And we are going to record at this end as well. And so should anyone run into a recording problem, we will have the opportunity to give you a recording of this media availability. So again, thanks for your interest. With us today, a state epidemiologist, Dr. Sarah Kemble. She, of course, works here at the Department of Health. And from the Department of Education is our interim superintendent, and that is Keith Hayashi. Dr. Kemble, I think we're going to open with remarks from you, and then we will get remarks from Superintendent Hayashi, and then we'll entertain questions. And we'll take this right up to about 1 o'clock or so. I think there's lots to talk about. Dr. Kemble, thank you very much.
Thank you, Brooks. And I know Brooks just said some of this, but I'm going to repeat some of this because I think it's really important. We are in the 7th consecutive week of increased COVID-19 cases in the community now, with a new 7-day daily average of 722 as of today's reporting. Hospitalizations continue to rise, and ICU admissions are now also increasing, beginning to increase. So I think this is a really important juncture. We've talked before about watching these numbers, and that case counts alone don't tell the whole story, but we are now seeing the repercussions for severe disease and accumulating cases in our hospitals. Even though vaccines absolutely work to reduce risk of severe outcomes from COVID-19, if you have lots and lots of COVID circulating in the community, some people who test positive are still going to get seriously ill, and some people are going to die from COVID-19. So staying up to date on COVID-19 vaccines remains the best thing you can do to protect yourself and your loved ones from COVID-19. It's also really important to know that if you get sick, there are effective treatments available in an outpatient setting. So anyone at risk of severe outcomes from COVID-19 should get tested as soon as they develop symptoms and should get treated if they test positive. Individuals who are at high risk include people who are 65 years and older, and individuals with underlying conditions such as cancer, diabetes, obesity, and other conditions. You have to start treatment within 5 days of your symptom onset to be effective. So it's important to get tested as soon as you develop symptoms and to get treated right away if you test positive. Even with vaccines and treatment, if we let COVID-19 spread unchecked, it will still lead to deaths and it could still overwhelm our hospitals. It's not just about how many COVID patients are ending up in the hospital. It's also about our capacity to provide healthcare to keep people safe. So it's about our healthcare workers as well. This means exercising caution for healthcare workers, but also for us in the general community in our everyday activities. Controlling spread of COVID-19 through layered mitigation practices like masking in indoor spaces, staying home when sick, and avoiding crowds. These are the things that each and every one of us can do to reduce spread and keep our communities safe. There are also many implications of COVID-19 in the long term that we still don't fully understand. There's long COVID. We know that there is quite a high proportion of people who get COVID have lasting effects weeks after their initial illness. So it's something that you really need to consider all the implications of. This is a time for businesses, schools, and other organizations to make sure they have COVID smart policies in place. Requirements to mask indoors at work and school make good sense when community transmission is high. Businesses should remind employees to stay up to date on their COVID-19 vaccines, ensure flexible sick leave policies, and should actively encourage employees to stay home when sick. Nursing homes and other congregate care settings should be increasing screening for COVID-19 among patients, visitors, and staff. By doing your part, staying home, even when it's just a sore throat, getting tested as soon as you notice symptoms, wearing a mask in indoor public spaces, and staying away from crowds. If you do these things, you truly can make Hawaii a safer place. And so we are counting on all of you. Please go up. Thank you.
Thank you, Dr. Kemble. And now let's get some thoughts from Interim Superintendent Hayashi before we go to the question and answer.
Thank you, Brooks. Good afternoon, everyone. Just like in the broader community, this marks the 7th straight week of increased case counts in our schools since spring break. A total of 1,053 confirmed or probable cases were reported across our 257 public schools all of last week. By comparison, during the height of Omicron, we saw numbers like these in a single day in mid-January. But it's still a cause for concern as we closely monitor conditions. Our schools continue to enforce the core mitigation strategies to reduce the risk of exposure, including universal indoor masking and staying home and feeling unwell. This week, one of our schools had to shift to distance learning because a number of staff were impacted by isolation or quarantine requirements. We haven't had to make a transition like that since Omicron. While this particular case doesn't appear to involve transmission or spread on campus, it's a very real reminder that we are still in a pandemic. We have just over 2 weeks left in this school year, and we want to finish our year strong as we head into summer. Next week, we have more than 40 graduation ceremonies planned across the state, with the first commencement scheduled for Monday. Our schools and students have worked hard to get to this point, and we definitely want to be able to celebrate this achievement with family and with friends. Schools have a flexibility to determine event-specific details to maintain the health and safety of all attendees. The number of guests allowed and lay giving, for example, may look different at various campuses based on venue considerations and other factors. We continue to distribute home test kits as an added safety measure schools can use for events like graduation. We've distributed 500,000 home test kits to schools over the past month. Please use this tool before attending any events. We ask for everyone's help to please be respectful of the safety protocols that schools are putting in place to ensure your safety and the safety of our broader community. We encourage everyone to continue doing their part so that we can get through this together. Thank you.
Thank you very much, Superintendent Hayashi. We appreciate your remarks. And now we'll open it up to questions. I would ask that you please raise your hand and then we will call on you. And I believe that we have sufficient time to get through this group. So we've got hands going up already. We'll start with Samie Infante, who is at the Star Advertiser, and then we will go to Kristen Consillio at KITV, and we'll just keep working down the line. Samie, thank you for being here this morning.
Thank you very much. Thank you very much, Brooks and Superintendent and Dr. Kemble. My question has to do with, the COVID-related guidance that has been given to the schools. I know in the past there were requirements in the original versions, right? So think back a few months ago, they were a bit stricter in terms of having, requiring COVID vaccines, requiring masks not only indoors, but perhaps outdoors as well, depending on the situation with the numbers. And I guess my question is it possible that with the rising numbers that those requirements could come back? Are they being considered? And if so, what would be the triggers and metrics?
I think that one's for me. So our requirements remain unchanged as of today, and that is still that masking indoors in schools is strongly recommended by the Department of Health. For schools that are opting not to require masking, there is a requirement still to quarantine after an in-school exposure. So for schools that are observing all of the layered mitigation practices, including indoor masking as a universal policy, there is a relaxation on the requirement to quarantine. And we continue to see, as we track clusters, that when layered mitigation, including the indoor masking, is being used, we're not seeing a lot of spread in schools. And that's what the basis for that policy is. And that's what we plan to keep in place. Now, with the rise in case numbers, if you look at the CDC community levels, which we also reference and use, as we head into the yellow and then potentially into the red, the recommendation is to think about really requiring masking for settings like schools. And so that too, we point to. So for schools that are making that decision, this is a time to rethink masking policies if you are making it optional and think about requiring it.
Is there a follow-up, Esme?
I have some follow-ups, but I'll let other folks go because they're not related to that particular question.
Okay, thank you very much. Let's move now to Kristen Consillio with KITV.
Thanks, Brooks. Hi, Dr. Kemble. So there's a direct correlation with the end of the mask mandate and this spike in, cases. And so I kind of wanted you to talk a little bit about that, because how do you change the mindsets of people once, they're not required to do something and they kind of think, okay, requirements done. This is, they don't care as much, I guess. So can you speak to that?
I think you're pointing to a sort of a social phenomenon that's very real. I would also say, however, that there were many things that changed at the end of March, and indoor mask mandates were one of them, but we also saw an end to the Safe Travels program and some of the federal requirements as well. So we're seeing multiple changes at once. And that's always a time where, okay, how do you break that down and decide what's being the biggest cause? The main point now, though, is masking is going to be more critical as case numbers continue to rise and as we see an impact in people being hospitalized and severely ill. So wearing a mask indoors, absolutely a very good idea right now, especially in crowded settings. I think the next things that really policymakers need to look at is, at what point do we have concerns that we can't provide the healthcare that we need to provide have confidence that we're going to be able to do that. And those are decisions that have to be made at a policy level. As individuals, we know what to do now. We know that masking can reduce spread. We know that avoiding crowds can reduce spread. So you can make personal decisions about avoiding that really big party. Let's defer that until another time. If you are doing a larger event, make sure spacing and ventilation are adequate and that everybody's wearing a mask. So there are ways to do that safely. The decision to make mandates is really a policy level decision.
So you wouldn't directly correlate this spike with the end of the mask mandate?
I think it contributes because of that social phenomenon you talk about. When we think that, okay, things in general are relaxing, maybe I can be more relaxed. I'm going to have that party I've been waiting for 3 months to have. What I'm saying today is this is not the time to be in that relaxed mentality. Let's remember that right now is a time to really be cautious.
Thank you.
Thank you, Kristen. Let's go to Hawaii News now with Samie Solina.
Thanks, Brooks. This is for Superintendent Hayashi. Could you discuss if there has been any disruption in schools with staffing being out, or classrooms or schools, whole schools themselves having to turn to distance learning?
Thank you for the question, Sammy. We are continuing to monitor our data at the schools. And so as of right now, we just have had one school that has needed to transition to distance learning for a week. Other than that, we're, as usual, taking it case by case and assessing each individual case or situation at a school individually.
And was that Molokai Middle School?
It was Molokai Middle, yes.
Okay, perfect. And then could you comment on any staffing changes? I know in the beginning of the semester, that was definitely a struggle for a lot of schools as cases rose, teachers calling out. Are you guys having the same struggles now?
Well, over the weekend at Molokai Middle, the department leadership made a decision to transition the school and working together with the principal to distance learning for this week. It being a small school, we and that was also taken into consideration, related to staffing and how that impacts the school. So that decision was made for Molokai Middle. As of right now, we haven't had any other situation at schools where we've needed to have that discussion with the school leadership and our state leadership. So we're really counting on our broader community to continue to implement those strategies that Dr. Kemble has shared. I think it's all of us working together to keep our schools safe and everyone safe. I think what's really important is that with commencement coming up and graduations, we really want to be sure that we have an opportunity to honor our class of 22 graduates. And so we ask everyone to please continue those strategies that we've been, especially with masking and being vaccinated and so forth, that staying home when you're sick will really help our schools to be able to honor our graduating seniors.
Thank you.
Thank you, Sammy. We appreciate it. Let's go to Civil Beat and Cassie Ordonio.
Hi, can you guys hear me?
Yes, indeed.
So last week we noticed in the cluster reports about the school proms and it specified flu cases. Is that a sign that COVID is becoming like the flu in a way? And at this point with all the variants, what is the difference between COVID and the flu?
I would say that COVID really remains very unlike the flu, except in being an infectious respiratory pathogen. COVID is still in a pandemic state, whereas flu is something where we may see seasonal epidemics, but largely an endemic state. Again, as we stated a few weeks ago in a recent press briefing, we do not feel that Hawaii is out of the pandemic, and the worldwide, certainly we're not out of the pandemic either. What we referenced in the cluster report was that we are now seeing clusters that are multiple diseases at once. And respiratory diseases are like this. We've seen in past years, even before COVID came along, you could have outbreaks of respiratory illness that were not just one disease. It wasn't just flu, it might be flu and adenovirus. And so we're seeing the same thing now, which tells me that a lot of people are being less careful about masking and infection prevention kind of practices like hand washing and avoiding crowds. So when you are now congregating and you're not having your mask on and you're not thinking about those hygiene practices, the daily preventive practices, then it's not just COVID that can increase, it's also all the usual respiratory diseases we have seen in the past. So we're definitely seeing flu pick up now. So this is a great time to get your flu shot as well. And to keep in mind that if you don't want to be sick for graduation, this is a good week to really play it safe.
All right, thank you, Dr. Kemble. Appreciate it. Let's go now to KHON and Jenn Boneza. Good afternoon, Jen.
Good afternoon. Hi, Dr. Kemble. Hi, Superintendent. Okay, so what it sounds like to me is that there are really not going to be any changes made for commencement or graduation ceremonies, anything that has been planned up to this point. You're just reminding everyone to stay safe, wear your mask, try to avoid crowds, don't go if you're sick. So that's what I'm hearing with that. And then as far as students graduating, so this would probably be for Superintendent Hayashi. This year, I'm sure most seniors have missed school more than any other time in their life due to COVID and being close contacts. Are schools making exceptions because kids have missed an exorbitant amount of school because of the pandemic?
Thank you, Jen, for the question. Our schools have worked extremely hard as we return to in-person this past school year in doing all that they can to help support our students, both academically and socio-emotionally. The students that are graduating definitely have met the requirements in order to graduate. As in all other years, if we have students who need additional supports, we'll definitely provide that for them. We work really hard so hats off to our teachers, our school level administrators, our students who have worked extremely hard returning to school and to in-person learning, as well as to our parents and our families for providing the supports for them. So we're really excited about the class of 2020 commencements and look forward to honoring all of our graduates this year.
I just wanted to jump in on the nothing has changed for graduation guidance. While the specifics of graduation and how it can be conducted haven't specifically changed, we're really glad that the DOE has been able to get a lot of home test kits out ahead of graduation. Use those test kits. Test before you go to graduation. That's another way to make ceremonies safer.
Thank you both. And Jen, does that satisfy your question? You have a follow-up?
Well, it is sort of related. I do have a follow-up. Does DOE plan to keep distance learning permanent? Is that going to be a permanent thing since we're not out of the pandemic yet?
Distance learning will continue to be an option for families. We do definitely, however, encourage in-person learning. We've seen and heard from students, from families, from our teachers, that when students are in person, in school, getting the supports that they need, whether it's academic supports, mental health services, lunches and having their meals, and especially being with their peers, I think is a definitely an added benefit that can't be replaced if students are on distance learning. So while there will be an offering, we still very much so advocate for our students to be in person because of all of the benefits.
Thank you, Superintendent. With Hawaii Public Radio, Zoe Dim.
My question is for Superintendent Hayashi. Do you plan to add any regulations to summer schools?
Can you expand when you mean when you say regulations? What type of regulation?
Any kind of COVID regulations like testing, masking?
We're pretty much going to be maintaining, I believe, again, working closely with the Department of Health. Currently maintaining what we're doing now. And as we move forward, we'll see if we need to adjust either way. Again, I think it's important that all of us heed the advice from the Department of Health, do our part as individuals to keep our schools and our communities safe. That way, we can get through all of this together in a positive way. So as of right now, there are no changes.
And I'll just to add to that, the Department of Health did review case numbers and case reporting from schools, and we've met with DOE on this to understand what impacts COVID is having in schools. So we came to the decision this week that there will be no changes in the school guidance, which applies to summer programs as well in K-12 settings. So that means continued guidance for indoor masking for summer programs.
Thank you both, and thank you, Zoe, for the question. Let's go, if we can, now to Nina with the Honolulu Star-Advertiser, who I think has a question about clusters.
Great. Yes, thank you. Dr. Kemble, I was wondering, besides the high school proms, what other clusters are you seeing? Where else, are infections and outbreaks happening?
So we did a special edition cluster report this past week, and we highlighted the proms, but also there are other events that we've tracked that are not on campus, but related to, school communities where we are also seeing transmission. So basically any large event that may involve community members and not just, students and staff, we're generally seeing transmission associated with those kinds of events. We also continue to see transmission in early childcare settings, which has always been a challenge because of the children under 2 unable to mask consistently and or safely, and that you just have an environment where kids are going to mix a lot. We also continue to see athletics related clusters. So you can look at our cluster report online to get the detailed breakdown, but that's the general picture that we're seeing.
Okay, great, thanks. One more follow-up question. It looks like vaccination rates, people are still getting vaccinated, but they've been pretty level and they seem to have tapered off. Is it really important? Because I know some experts are also predicting a fall surge. It could potentially infect 100 million Americans or more. Are we preparing for this fall surge in Hawaii?
Thanks for that question. I think there's a really important point here. During the Omicron surge, and currently we're seeing infections sweep through much of our state. So even many of those who were previously unvaccinated may have been infected now. One piece of science that's emerging is it looks like if you've only had an Omicron infection, you are not as well protected against reinfection as if you've also had vaccine. So if you've had infection recently and you think that's a reason not to get vaccinated, think again. This is a really good time to go get the shot, even if you hadn't considered it before.
Thank you. And what about the fall surge that some people are anticipating?
I think my personal philosophy is we have to be ready for surge at any time. We might be having our next surge now. So there may be a surge in the fall, there may not be, there may be a surge in the winter. I think we're still in a mindset of surges are possible and we don't know where this will all settle out yet. That's part of not being in a truly endemic state yet. Preparedness is really key here, and keeping in mind all of the tools we now have to combat COVID-19. We've got to use them.
Okay, thank you.
Thank you, Nina. And as long as you're talking about vaccination rates and whatnot, I would like to point out that Dr. Kemble's staff recently added some features to their data dashboard. And it's been up since last week. I don't think a lot of people have noticed it, but if you go to the vaccine summary section, there are several options for you. And if you click on for example, the age section, you will see that just 21% of seniors age 75 and older have received that second booster. I'd encourage you to check out those numbers, see what you find there. But 21% of 75 and older, 18% of those 65 to 74 years old have received their second booster. Let's continue the questioning if we can. We'll go to Kehau at Maui now, and then we'll circle back for a second round with Esme and Samie and maybe some others. But let's go over, if we can, to Maui. Kehau.
Thank you, Brooks. This message is for Superintendent Hayashi. You spoke briefly about lay giving, and I think there's still a little bit of confusion, at least on Maui, over whether it's restricted or not at some schools. Do you know any schools that are banning lay giving for their commencements, and if so, which ones?
I don't know of any specific schools that are banning lay giving. Schools are implementing various strategies, though, as I shared earlier, about perhaps those that are ticketed would be allowed to give lay. Each situation is a little different, and so schools do have the flexibility to implement strategies that best fit their respective area and the needs within their community.
You have a follow-up, Kehau?
No, I'm good. Thanks so much.
Thank you.
Right. Thank you very much. All right, Esme, you've got your hand up again. Let's go back around.
Okay, thank you very much. I wanted to make sure that I did hear correctly, because I know I've been asking for a while about clarification on masking and other COVID restrictions for summer as well as for fall. So are we indeed making an announcement here that summer programs will indeed continue to require indoor masking? And then has any decision been made for the fall as well? And then related to that question, I wonder if Dr. Kemble might elaborate about how common it might be for children to pass COVID to kupuna with severe results in Hawaii, because that seems to be something that we keep hearing about as a reason for masking?
So first, again, for summer, our K-12 guidance applies to summer programs, and we will not be changing it. So our K-12 guidance states that masking indoors for school programs is strongly recommended for all school activities. For schools that do not implement universal indoor masking policies, there are strict quarantine requirements around exposures in schools. For those that do implement strict indoor masking, quarantine is relaxed, and so there's capacity to keep more kids in school. Now, for the fall, those decisions have not yet been made. We will continue to review the numbers and the data in the coming weeks as we move through the early months of summer June, and we will be issuing further guidance about the fall, but we don't have that at this time. In terms of the capacity of children to transmit COVID-19, children are able to transmit COVID-19 to family members and loved ones and to other people in general. We've learned a lot about COVID-19 that in people in general can transmit it, symptomatic, asymptomatic, even being vaccinated. While it does reduce transmission somewhat, doesn't eliminate the possibility of transmission. But particularly for our younger children that haven't yet had the opportunity to be vaccinated, transmission risk can be pretty high. And so that's something to keep in mind. It's not just the child themselves, it's who they live with and who they're around. Have grandparents been vaccinated and boosted? Are they fully up to date on their vaccines? Think about that now and look at your family situation and make sure everybody's taken all the precautions that they need to take as a family unit, not just as an individual.
Thank you. As a really super quick follow-up, since we're talking about transmission and clusters and related things, hepatitis, since I know Dr. Kemble was talking earlier about how you will see, clusters of things happening at the same time. I know we talked about that acute hepatitis situation on Maui, and we're hearing now that there are some cases in the DOE. Can you folks clarify, confirm, and what kind of level of concern there is?
As of today, to my knowledge, we only have a single report of a patient who's under investigation for this acute hepatitis. We still don't know the cause of what's causing these acute hepatitis cases throughout the United States and worldwide. And there is ongoing investigation into that nationally and internationally. And Hawaii is participating in that by, collecting information on our patient that we're following and making sure we share information and thoughts with our national partners.
Thank you. And now back to Hawaii News Now and Samie.
Hi, this is for Dr. Kemble. I know that in the past 7 days, average has been over 700, and those are officially reported tests. Could you talk about just the availability of at-home tests and what that does when you guys look at just how much community spread there is, knowing that there's all these at-home tests and they're not officially reported to Department of Health?
The movement into having at-home testing widely available, I think, is a really good thing. Of course, it does limit our visibility into exactly how many cases there are out there. But as we've stated before, our attention has really shifted to what's the severity of the cases we're seeing, how many cases are ending up in the hospital, what kinds of risk factors do we see for people who end up in the hospital? Were those people getting treatment when they should have? Because that's one thing we can intervene on and try to get people treatment earlier so that they don't end up in the hospital. So there's a lot of other factors we want to look at now besides just sheer numbers of cases. The good thing about having at-home tests widely available is you have an answer really quickly in your own home. And you, as long as you have that information, what to do about your positive test, go to our website. We have one-pagers, we have QR codes to get that information, what to do if you're positive. You got to know to isolate, to tell people that you've been in close contact with so they can quarantine if they're not up to date on their vaccines. These are the steps that everyone can do now with at-home test kit. One important thing about at-home test kits is that if you have symptoms and you get an initial negative test, you need to wait and repeat your test 24 to 48 hours later. And a single test may not turn up positive that very first time. This is particularly true now that more and more people are vaccinated. So there may be a little more of a delay before the virus builds up enough to show up on that home test. So this is the importance of staying home when you are sick. Even if you think it's just a small symptom, stay home when you're sick, take that second test on day 2. If you're at that point still testing negative, then you can be more relaxed.
Thank you.
All right, is anyone else going to raise their hand? I don't see any hands at the moment. Very productive session, and I certainly appreciate Superintendent Hayashi and Epidemiologist Kemble sharing all this information. I should note that while we've been talking, I checked the HIEMA information hub, and I see that they are now reporting 91 people in Hawaii hospitals with COVID, and we have 8 people with COVID in the ICU. Those numbers have grown steadily. I believe it was March 27th, we had just 11 people in the hospital with COVID, and now we are up above 90. And as you know, hospitalizations are a lagging indicator. And as the COVID numbers continue to go up, we can expect that hospitalizations may follow shortly thereafter. We are coming up on 1 o'clock. You have asked some really smart questions. We very much appreciate it. And we appreciate you getting the word out to the public that the numbers are escalating. And we really want you to do everything you can to safeguard the graduations. And so those youngsters can enjoy what they deserve, which is a great day in the sun after what they've accomplished. I offer up an opportunity for Dr. Kemble or Superintendent Hayashi to make any last statements before we sign off today.
I just want to say again, really, we've come a long way in this state. We have achieved one of the highest vaccination rates in the country. People, I think, really have taken Ohana to heart in Hawaii, and so we've been respectful of each other. I know we're all tired with the pandemic, but this is really a crucial moment to continue that Ohana and to take care of each other. So please act with kokua. Thank you.
I'd like to also echo Dr. Kemble's sentiments that we're all in it together, and by helping each other and making the right choices, in focusing on our graduates and our students in school, everyone in the broader community doing their part, staying home when they're sick, and implementing those mitigation strategies will help us to really celebrate effectively for our seniors and send them off this school year on a very positive note. So just want to thank everyone and our communities for the support of our high schools, middle schools, and elementary schools. So thank you very much.
All right, thank you all very much. We very much appreciate it. Hey, thanks. Let's all continue to show aloha and respect for one another, and keep your eye on the number and keep your eye on your family. And we will continue to persevere and get through this. Thank you all so much for your time. Mask up and get up to date on those vaccines. Have a great day, everybody. Thanks for your time.
Thanks, Brooks.